staggering numbers. At least 85,000 New Zealanders a year are being turned away from seeing a specialist, some of them dying as a result. Researchers from the University of Otago have described it as a national scandal. One general practitioner told the study they had managed a heart patient into the grave because she could not get the care she needed. Another talked about their fear of trying to care for teenagers with serious mental health problems, including hallucinations, who could not get into a psychiatric's clinic. Researchers used nationwide Health New Zealand Te Whatu Ora data to conclude it was getting harder every year for Kiwis to access specialist doctors. One of the study's authors, Health Systems Professor Robin Gauld, says the upward trend was continuing and was a national scandal. And he joins me now. Professor, good afternoon.
Kia ora, good afternoon. Very good to be here.
Yeah, thank you, Robin, for being available. Now, were you shocked at these figures?
Well, yes and no, because, this has been an ongoing challenge for our healthcare system, actually for at least a couple of decades, if not longer, since we started to look at unmet need within the health system. So, no, but yes, because the numbers have been going up, and we've done statistical analyses on these data, and so we know that the changes year on year, it's a 5.2% increased risk of being declined per year on year of our study that we've found. So, this is a statistically significant increase, and that's really the surprise, I think, is the level of increase and the level of people who are now being declined. It's gone up over 17,000 over and above that sort of rate of, it was 68,000 declines in 2018, it's 85,000 in 2022, and we're predicting another 5,000 or so per year from here on.
Is it solely, I'm guessing, because we just don't have enough specialists, we haven't trained enough people, or is there just not enough budget?
It's a combination of factors. So, yes, our workforce is under huge stress, and that's been an ongoing issue. It's gotten worse more recently. So there's that issue. Then there's the funding. Often the workforce may be available, but there's not the funding able to be allocated to, get clinics going and operations and so forth. So that's an issue as well. Sometimes it's facilities, so it's a sort of a whole range of factors. And then it's just the long-range planning to ensure that the system's able to cope with, a fairly predictable level of demand coming onto it.
I see too, the study conducted detailed interviews with 43 GPs about the impact on their patients. Was there a common thread with them, Robin?
Yes, I think the common threads would be that demand has been increasing on the GPs over time, and they are under a lot of demand anyway. We know that a number of general practices around the country aren't accepting new patients because they are so overbooked. Yeah. So this just adds further pressure on them when they're managing patients who they shouldn't be, because let's not forget that these are people who should have been seen by the specialist, the hospital sector, and be managed by them, but they're being sent back to be managed by the GPs. So by default, the GPs are undertaking effectively managing patients with secondary amenable healthcare needs, and that's putting huge pressure on them. So that was the other theme, really, was that they're doing things that they shouldn't be doing, that they don't feel comfortable with. They're managing patients; it's very stressful on them. They're not receiving additional funding or support for this sort of work. So there's a whole range of factors that are impacting them pretty heavily.
I saw that too. You've mentioned it, that some of the doctors were concerned that because they can't, get their patients in to see specialists, they feared doing the wrong thing, maybe prescribing strong medicines, opioids or for psychiatric medicines. That must be hard on doctors as well to just, and I put it in the intro from the story about one doctor saying that she managed her heart patient into the grave. Be terrible.
Yeah, this is part of the national scandal, really.
Yeah.
The GPs shouldn't be being put in this position, and this is one of the reasons why we have recommended that we need to be thinking innovatively about how we start to manage unmet needs, so that the GPs have got the support, so that the pressure can be released, but there's the support there for the GPs.